Yeah. What do we got going on? What brings you in?
I don't know. I have chronic pain kind of everywhere.
Okay.
I've never had an alignment.
Never been adjusted, really?
Ever. So this is probably gonna be pretty lucrative for me.
Oh my gosh, this is gonna be fun. Any supplements or anything like that you're on, or?
No, like my lifestyle is pretty able to keep it maintained.
Okay. What do you feel with that?
Like I have like a lot of like joint swelling, specifically like in the hands and stuff.
Okay.
Some days I'm swollen like and tighter. I don't know if because of that it leads into like.
This will be fun today.
Yeah.
Let me have you go face down on the table.
Okay, perfect.
And then.
Arms like this?
No,
or?
I got you.
Okay.
You can go right up there, perfect. Yeah, we had just one up in the upper cervical area. Get a little dip in here, nothing crazy though. Tiny bit of rotation right here in that mid-thoracic spine. Good. There it was.
Okay.
Yeah, just gotta get some of those knots out of here.
Mm-hmm.
Oh, there it is. Okay. And we're gonna do both sides, so it doesn't matter which way you go first. All right, I'm gonna bring this headpiece out. Oh, there we go. Your head will go right in there. Perfect. I got you with that. So we're gonna bend that top right. That. Like that, perfect. So this is called a side posture adjustment. Okay, clear on that one. First one. Okay, good.
Oh wow.
Alright, we're gonna get that right side now. Good. And then directly over the sacrum. And there it was. You felt that one?
I felt that one.
Good. Go on your back for me.
Oh. Oh wow.
Rest.
And I feel something like shoot up to here. Is that normal?
Oh yeah.
Okay.
Let's get the other side here. There we go. And one more in the lower thoracic. That one was only one very little, maybe one in there. But that moved really well, that moved really well. Top here. So the first two adjustments that I like to do, we're gonna work on the lower cervical spine, that upper thoracic, and the in the mid-back area.
Okay.
We're gonna clear that first, and then I'll work down through the thoracic spine. So I end up getting every region in the entire spine. I like to look at the body as a whole and treat the body entirely as one unit instead of just doing like, yeah, that's taut muscle fibers in there.
Yeah, that hurts a bit.
Yeah. Today's gonna, just so you know, I'm a little bit more aggressive than your traditional chiropractor out there.
Okay.
My goal is to actually get you feeling better, not.
Oh, wow.
And rest. Catch your breath.
Oh, wow.
In and out.
My whole spine.
So a little bit of everything, right?
Yeah, it was mainly behind my neck.
Okay.
And then a little bit of my lower back, but I did feel like.
I don't know how much more I could have done on that low back. But no, I'm glad. That's the whole point, is getting everything balanced. Second one, you'll typically feel more in the ankle.
Okay. Oh, I felt that everywhere.
It takes pressure off all the nerve roots. You'll feel warmth right away because of increased blood flow going into the area.
Okay.
And then, yeah, now I use vibration, relax everything again. Feel
Okay.
good.
Okay.
Come on up. And then you can turn that way again. Perfect.
Yeah.
And even like this one, you're like, yeah, I still feel like throbbing or whatnot.
Yeah. It feels sore but loose. Like I've never felt this loose in my neck before.
Good.
Yeah.
Stand up, kind of move around a little bit.